வெல்கம் டு விஜே ட்ரெண்ட்ஸ். இன்றைக்கி எம்ஆர்பி எக்ஸாமினேஷனுக்கு ரிலேட்டடாக ஒரு 10 கொஷின் அப்லோட் பண்ணியிருக்கேன். இந்த வீடியோவை லாஸ்ட்டு வரைக்கும் பாருங்கள். இம்பார்ட்டண்டான கொஷின் தான். இதை கடைசி வரைக்கும் மிஸ் பண்ணாமல் பாருங்கள். Which of the following is used to assess the level of consciousness? The options are Braden scale, Shannon chart, Apgar score, Glasgow coma scale. First, what is Braden scale? Braden scale, it is predicting pressure, so risk, that is used for Braden scale. Shannon chart, which is a geometric scale to measure the visual acuity, and Apgar scoring, which is measure the baby condition after birth. And what is Glasgow coma scale is? Glasgow coma scale developed to help and determine the severity of coma or dysfunction followed by the traumatic brain injury, and it can be also used any condition leading to the impaired consciousness. And about the GCS, that is Glasgow coma scale, it is a simple measurement was originally which is developed by the University of Glasgow in the year of 1974. The answer is Glasgow coma scale. Distended abdomen and absence of bowel sounds after abdominal surgery most probably indicate. The options are paralytic ileus, pancreatitis, intussusception, ruptured colon. And what is paralytic ileus? Paralytic ileus, it is there is a muscle contraction that helps the food to move in the intestine. But in this condition, there is absence of that contraction, that is temporarily paralyzed in the muscles of the intestine, because which is due to the functional problems of muscles and nerves. So that is paralytic ileus. Pancreatitis, which is inflammation of pancreas. Intussusception, it is inversion of one portions of intestine to another portions of intestine, that is called as intussusception. The answer is paralytic ileus. Inflammation of the tongue is known as. Options are glossitis, parotitis, gingivitis, stomatitis. Glossitis, which is inflammation of tongue. Parotitis, inflammation of parotid gland. Gingivitis, which is inflammation of gums. Stomatitis, which is inflammation of mucous membrane of the mouth. So the answer is glossitis. Glossitis, which is inflammation of the tongue. Which of the following need to be performed before radial arterial cannulation to evaluate radial and ulnar artery patency? Options are capillary refill test, Allen's test, angiography, and Berger's test. The answer is Allen's test. About Allen's test, it is a hand flushing method to assess the arterial patency. So the answer is Allen's test. Which of the following is the most common cause of failure to pass meconium within the first 24 hours after the birth? The options of Hirschsprung disease, celiac disease, intussusception, abdominal wall defect. And what is Hirschsprung disease, which is a condition of large intestine? Due to this inability to pass the motion, because there is an absence of nerve cells in the large intestine, that is Hirschsprung disease. Celiac disease, which is hypersensitivity to gluten, due to that the food unable to digest properly, that is celiac disease. Intussusception, which is inversion of one portion of intestine to another portion of intestine, that is called as intussusception. Abdominal wall defect, which is opening of the abdomen, through that all the abdominal organs will be protrude outside. Finally, the answer is Hirschsprung disease. One of the major cause for cirrhosis of liver, the options are alcohol abuse, smoking, drug abuse, viral hepatitis. The answer is alcohol abuse. And what is cirrhosis of liver? It is a late stage of scarring, that is fibrosis of liver caused by many form of liver disease. Distance vision assessed by, the options are Hirschsprung test, confoundment test, Shannon chart, Jahar chart. The answer is Shannon chart. What is Hirschsprung test? So which is detect the misalignment of the eyes, that is strabismus to the children, young children, patients with poor vision. And what is confoundment test, which is visual field test. Shannon chart, geometric scale to measure visual acuity, and Jahar chart, which is assess the near vision acuity. The answer is Shannon chart. Which of the following ECG finding indicates the presence of hypokalemia? The options are ST segment depression, widening of QRS complex, prolonged PR interval, tall peak, T wave. The answer is ST segment depression. And what is hypokalemia? It is deficiency of potassium in the bloodstream. Which of the following is used in the management of hyperkalemia? Options are insulin with glucose infusion, magnesium sulfate, sodium bicarbonate, potassium chloride. The answer is insulin with glucose infusion. And what is hyperkalemia? Which is increased potassium level in the bloodstream. Common risk for severe depression is, the options are suicide, thought block, fatigability, hallucination. The answer is suicide, because the patient with severe depression, they have a tendency to commit suicide. இந்த கொஷின்லாம் உங்களுக்கு ரொம்பவே யூஸ்ஃபுல்லாக இருக்கும்னு நினைக்கிறேன். இந்த வீடியோ உங்களுக்கு பிடிச்சிருந்ததுன்னா லைக் பண்ணுங்கள், ஷேர் பண்ணுங்கள், சப்ஸ்கிரைப் பண்ணுங்கள், கமெண்ட் பண்ண மறந்துடாதீங்க. ஒவ்வொரு கமெண்ட்ஸும் என்னோட இம்ப்ரூவ்மெண்ட்க்கு ஹெல்ப் பண்ணும். எக்ஸாமுக்கு ப்ரிப்பேர் பண்ணிகிட்ருக்க எல்லாத்துக்கும் ஆல் த பெஸ்ட். அண்ட் இந்த வீடியோவை பார்த்ததுக்கு ரொம்ப ரொம்ப நன்றி.